So as we continue our discussion of regulatory and ethical considerations in pharmacy, I'm going to reintroduce for a second time in our guest interviewee videos, Connie Jung. She is pharmacist and PhD. She's working at the Food and Drug Administration. She's acting associate director for policy and communications in the Office of Drug Security, Integrity, and Recalls in the Office of Compliance at FDA. And so this will be our second few minutes that we'll spend with Connie. And Connie, this time we're going to talk with you about ways that we ensure drug quality and safety. And we'll kind of get into the area of post-marketing surveillance a little bit as well. So thank you for being with us again. We appreciate your time. So one of the things we've been learning in this Introduction to Pharmacy course is about medication safety and some of the issues that surround medication safety from a practice and also from a regulatory perspective. Can you tell us what FDA does to help ensure medication safety once a drug has been approved for marketing?
It's essential that additional information about a medical product be obtained by FDA during post-approval use. Post-approval information can let us know if a product's use leads to serious adverse events and sometimes even death. Now, while this may be rare, FDA is committed to providing accurate, science-based information on the risk and benefits of the use of certain medical products that we regulate to all of those who use them.
So, Connie, also in our course, I've briefly described to our students some FDA initiatives to monitor and prevent post-marketing adverse drug events. So we've talked about some things like the MedWatch program, the Sentinel initiative, and the Safe Use initiative among these things that we discussed. Can you tell us maybe a little bit more about these particular programs or perhaps other things that FDA is doing to help ensure drug quality and safety post-marketing?
Sure. The MedWatch program is designed to enhance the agency effectiveness of post-market surveillance of medical products as they're used in the clinical setting. And the system allows FDA safety reviewers to rapidly identify potentially significant health hazards associated with medical products. As you know, adverse events can be reported both on a voluntary and mandatory basis from healthcare providers, consumers, and the industry itself. And this is a key way for the agency to learn about those potential problems with products once they're in clinical use.
Yeah, sure is. So what about these other initiatives? What about this, for example, the Sentinel initiative and the Safe Use one? What role do they play in this?
The Sentinel initiative is a very interesting one. This initiative aims to develop and implement a proactive system that is intended to complement existing systems already at the agency and helps to track adverse events linked to the use of certain regulated products. The system will draw on existing automated healthcare data from multiple sources so that we can actively monitor the safety of those products in real time.
So MedWatch, maybe we might think of more of a reactive sort of a system, and then when we get to the Sentinel initiative, we're being more proactive. Is that correct?
That's correct. Yeah. And it's also based on different types of information. So the Sentinel initiative, as I mentioned, it uses healthcare data from multiple sources, such as electronic medical records or payment information from insurers or payers.
And then the Safe Use initiative takes even a different tack, doesn't it?
It does. The Safe Use initiative has the key goal of trying to develop partnerships and collaboration between those entities. So it could be FDA in addition to other stakeholders that are committed to preventing risk associated with the use of certain medications. One example of that highlights the success of this initiative is the recent publication of a white paper by NCPDP, which is the National Coalition of Prescription Drug Programs, with recommendations on how acetaminophen should be spelled out rather than abbreviated so that consumers and patients can better understand what's in their prescription medication and the possibility of interacting with over-the-counter products that may contain the same ingredient.
So you've used an example of acetaminophen, but thinking of ways that we communicate information about drugs to patients and how they interact with other kinds of agents. And I guess as I think about what you've just described to us, we're looking at ways of reporting problems, we're looking at ways to prevent them in terms of integrating databases, and we're looking at ways to collaborate to help prevent those safety issues from even emerging. So it's kind of a comprehensive look, isn't it?
Yes, that's a good way to put it.
So Connie, we've talked about what FDA is doing, but from your perspective as a pharmacist and as an FDA staff member, what more can and should pharmacists do out in the field in terms of helping us to prevent post-marketing problems?
Pharmacists can play a key role in helping the FDA in determining the safety and efficacy of products once they're out in the clinical setting. I think there are two key ways that they can do this. The first way is by reporting adverse events, or in addition to encouraging either other healthcare providers or patients to report adverse events through our MedWatch program. As I mentioned before, this is the only way that the agency is going to find out about potential problems, and therefore we can then use that information, determine if there are any signals that warrant a regulatory decision. Some of our regulatory decisions include labeling changes, increasing warnings on a particular product, or even withdrawing the product off of the market if it's that serious. The second way that they
Go ahead. Sorry.
The second way that pharmacists can help is by educating. The second way that pharmacists can help is by educating other healthcare providers and patients about emerging drug safety issues. So while we've talked a little bit about how FDA is collecting certain information, whether it's in a drug review or whether it's through adverse event reporting, the agency takes that information and assesses it. And if there is a reason for a safety alert, we will issue a safety alert or even a drug safety communication. And these are ways that the agency can let pharmacists and other healthcare providers know about emerging drug safety issues. And often, if the pharmacist can amplify those messages to ensure that the prescribers know about it, and some of them are important for patients to know, I think this is another important role that pharmacists can play. Because some of these changes could include prescribing changes in dose, in addition to additional precautions or warnings for the patient.
So pharmacists educate patients, and we've talked about that in many different capacities. We can certainly do it around this issue. We can raise awareness, and we can report problems. And I guess also we can, you've said it, everyone watching this video, I mean, we as consumers can report problems as well. And so we can all be vigilant around this issue. Hey, Connie, my last question for you. You've got a pretty cool job at FDA, and you've had a very interesting career path. If I'm watching this and I'm thinking, I'd like to do what Dr. Jung is doing, what advice do you have for our video viewers in terms of preparing yourself for a job like the one you have at FDA?
This is one of the great things about the pharmacy profession, is that it allows you to have the opportunity or give you a background or foundation to do so many different things, not just what I'm doing at FDA, but certainly across the board in other settings. If you are interested in public health specifically, then the FDA is an agency to strongly consider. Gaining some practical pharmacy experience, I think, is helpful. As I mentioned before, that knowledge and that experience helps you as a regulator understand what's actually happening out in the practical setting. Because sometimes when we work in an office and we're talking about how a new regulation or a new policy that's going to affect drugs in the U.S., it's always good to know how that may play out actually in the clinical setting. For those that are interested in federal agencies, we have externship programs that students can try to can apply for during their last year of pharmacy school. if you're interested in the U.S. Public Health Service, which is where I am at within FDA, there are opportunities in your third year and also your last year to join a COSTEP program if you're curious about the U.S. Public Health Service. And that can lend a way for you to get your foot in the door into not only FDA but other federal agencies across the U.S. that work to promote and protect the public health of the nation.
That's great advice. The opportunity to get experiences at places like FDA or other federal agencies through things like the COSTEP programs, great suggestion. But I like the way you couch this, that what we really bring to the table is our pharmacy practice knowledge and experience. So I think getting a good foundation there, no matter what direction we're going in, always helps. So Connie, thank you so much for being with us. We're interviewing you via video conference from Washington, D.C., and we've had some little technological issues along the way, but I appreciate you bearing with us, and it's really a pleasure having you with us in this discussion.
Thanks for having me.